Hey, welcome. Welcome to our teaching today on supplementation in cancer treatments. Pluses, negatives, positives, ups, downs. What's the truth? We're told time and time again not to do it, that it's dangerous. So today we want to clarify, can you use supplementation? Can you take nutrients during chemotherapy, radiation therapy? Now remember, this is a short version. This is going to be a capsulized version. So I wrote down some overview points that we'll discuss. But the focus here is to take a broad brush overview to really try to educate you on what are the facts and what are the myths. Is this reasonable? Is it harmful? Can it actually enhance treatments? Can it actually help cells to differentiate, to really protect us? A lot of misinformation. We want to bring some clarity to this subject. It's a huge problem. It's a huge area of discussion today. The use of supplements in cancer, and I would say the use of supplementation in cancer treatment, traditional medical treatments. What can you do? Do they provide benefit? I really believe this will kind of morph into some future teachings. So this might be cancer supplements and treatment 1, and we might have a 2 and 3 eventually, because this is a very broad subject. As I approach this, I want to tell you, I approach it with some trepidation. I might almost say I've kind of avoided it, and I haven't wanted to talk about it. First of all, because it's controversial, but I've never shied away from talking about controversial issues, so I thought about it just the last couple of days. Why not? Let's go for it. Let's talk about it. This may benefit not just you, it may benefit future generations, it may benefit a family member, a loved one. That's what I want you to keep in mind. When we hear the big C word, when we talk about cancer, there is always an immediate, almost shutdown human nature, because normally we associate certainly cancer with inevitable death and destruction. So I want us to not fear this. I want us to be able to know what the facts are so that you can help your family make educated decisions, certainly, as well as yourself. I would be totally remiss if I didn't start this with some level of discussion. First of all, the Bible teaches us that as we pass from this life, that as we die the physical death, that does not mean necessarily that we have to die eternally. That as our physical body, this physical living structure passes, we have a spirit that can either live in eternity with the presence of God or eternity without the presence of God, which is termed hell in essence in the Bible. So I'm not going to fire and brimstone you today. I'm going to tell you that as much as we fear this big C word, and as it riles angst in every one of us, myself included, what do we bear down on? What do we find our hope and our truth in ultimately? Because even if we don't make it through a bout of this, am I dying permanently? I might be leaving this life, as sad as that is, to be away from your loved ones, and your loved ones are going to sorely miss you. But eventually, it's an inevitable eventuality. We will pass. And what happens with your eternity is what's really key. And this is not maybe necessarily appropriate for this specific subject, but I think that it follows because of during David's difficult times and his difficulties about how he just laments before the Lord. But before we go there, Psalm 4:8 says, "In peace I will lie down and sleep, for you alone, Lord, make me to dwell in safety." In peace I will lie down and sleep, for you alone make me to dwell in safety. Ultimately, we have to be able to get to the place where we are bearing down and trusting not in a wife, not in a husband, not in a parent, not in me, not in a physician, that ultimately our weight has to bear down completely on Him. In peace I will lie down and sleep, for you alone, Lord, make me to dwell in safety. We need Him to dwell in safety. We need Him to dwell in peace. We need Him in order for our minds, our spirits to be quieted and without discontent. And as David said, listen to my words, O Lord, and consider my lament. Hear my cry for help, my King and my God, and let all who take refuge in you be glad, and let them ever sing for joy. Folks, thanks for joining us today. Let's get into this. So I basically have a quick overview that I wrote up here. The controversies that surround this, supplementation in cancer treatments, abandoned therapies. What happens? We abandon many of our therapies because folks are so toxic or so damaged from their chemotherapy or radiation therapy. Without getting into details, but anything from mucositis, glossitis, I have ulcers in my mouth because of the radiation, or in my throat. The chemotherapy, I'm throwing up, I'm vomiting, I become dehydrated, I can't eat, I can't swallow. It's a huge, huge problem. Immune system defects occur in advanced stages of cancer. So this is where I want to talk about where supplementation, I believe, can help. How do antioxidants benefit? Most of the focus today is, in the medical community, is it's negative, it can't help you, it's crazy, what's wrong with you, why would you do that? There's no research, which is not true. And then the other end of the spectrum are folks in my camp that believe in alternative approaches that just tell you, do nothing else, just do this. I'm not here to tell you what to do. I'm here to clarify maybe some points on both sides of this. Cancer keys, I'll get into that. I'll talk a little bit more about what actually happens, how there's oncogenes, how there's inflammation, and what we're trying to do at a root level. Certainly there are cautions. What I mean by cautions, can we use all supplements just willy-nilly, use anything you want, take a bunch of supplements, no matter what form of chemotherapy you're doing, no matter what form of radiation therapy? I would say to you, no. I would say to you that there are cautions. And that's why I want to bring some clarity and some balance today. There are cautions that we shouldn't run off and just do whatever we want. We shouldn't just do things without counsel. But I believe what you got to do is receive your counsel when it comes to supplementation in your cancer treatments, radiation or chemo. And then we must define what forms of chemo, because depending on what type of chemo and what type of cancer, you would do or not do specific supplements. So the cautions are simply this, that you just can't take anything and everything. So there is a side that you need to be aware of, and you need to be educated. We'll cover the positives and negatives of supplementation, kind of ties into the cautions. And then what I really believe ultimately is that there's got to be a shift in focus. There must be a shift in focus, my humble opinion, in how we're treating cancer today. Excuse me. The focus has simply been burning, killing cells, and in that mode we kill everything. We kill good, we kill bad. No real thought is given, unless maybe you're dealing with melanoma, to the immune system. No real thought is given. And yet we see that in advanced stages of cancer, there's a huge breakdown in the immune system. The body loses its ability to even begin to defend and protect itself. Cachexia, breakdown of lean muscle mass, breakdown of body tissues because of the severity of chemo and radiation. I can't consume quality nutrients. I can't rebuild and repair. I can't restore. I don't eat. It's a vicious cycle. You break down, and literally 40% of the cancer deaths are not necessarily due to the cancer, but it's due to cachexia or breakdown of our human structure. Controversy, why therapies medically, I should put, are abandoned because of complete breakdown of the body. Immune system defects in advanced cancers. How do antioxidants benefit? What are the keys to cancer, my opinion? Cautions, what about the positives and negatives? And why there should be a shift in focus. So today, I'm not necessarily going to go my normal route of writing everything down, because it would be a little ludicrous to try to write all this down. So I've made some notes, and I'm going to leaf through the notes and basically kind of cover them as we talk about them. Where do I want to start specifically? Well, if we look at the controversy, I think if you really look, if you just pull up, you can just do some quick Medline researching. And it is shown that antioxidants and supplements can mitigate or reduce the toxicities of chemo and radiation. I think that even many medical practitioners would agree with that. So mitigate means to reduce some of the damage caused by the chemicals and the radiation. Where we then lose traditional practicing oncologists in this discussion, they might be with you there. Where we lose them then is they say that it actually interferes with what they're doing. Even though you might mitigate the side effects and the damage, but it interferes with what I'm doing. And I'll dispel that myth. So let's just talk about some of the quick things. I'm just going to read. I wrote these down just quickly. Folic acid. Now, I'm not telling you to go take folic acid, so don't misunderstand this. This is just a quick overview. Human studies. High doses of folic acid in non-small lung cancers improve survival from an average of 11 months to 41 months. Bladder cancers using supplementation, C, E, vitamin A, improved, now this is always the key, lifespan and mitigated, reduced some of the side effects. Malignant melanomas of the eye. When they put individuals on an aggressive antioxidant regimen, it improved length and lengthened survival. Inflammation we see in many areas, and especially with even this malignant melanoma of the eye, that there is an immune suppression factor that comes about from the inflammation. So why we have to look at nutrient supplements, reducing the inflammatory response as being a positive scenario. Advanced care cancer, we talked about it here, that in advanced stages of cancer, that there are immune system kind of defects. So what I mean by that is, as cancer progresses, the immune system starts to significantly break down. And unless I am doing some things that literally help the immune system to repair and restore and to rebuild, I'm going to have a continual downward progression. So let me continue to move through this. Animal studies have shown, now I'm going to jump over, those were a couple human, I don't want to use the word anecdotes, but just a couple snippets. There's tons. I can't even begin to delve into the depth. But let's just talk about some of the animal studies, which I know a lot of people would frown upon, which is ludicrous, because before things are accepted in medicine to be done in humans, they're first tried, tested, and true in laboratory animals. What we see is combinations of chemotherapy, when you combine them with certain nutrients, folate being one, actually enhances tumor suppression. So there are examples when you put specific chemotherapy agents with a specific nutrient, you actually enhance its actual killing abilities. We see that in animal studies. That's documented in some of the animal studies. All right, so some of the controversy. Why we abandon therapies, why medical therapies are abandoned because of breakdown, because the body's overwhelmed. The immune system defects as cancer moves on is a huge issue, and why folks need to supplement. So, for example, why we will do something like high protein smoothies with individuals. We give you specific recipes, make different kinds and flavors, and it might look something like this. A purified, highly purified whey protein, because of its high glutamine and high fractional content that really supports your immune system. So that if you're not eating well, so before we get to these breakdown areas and abandonment, we want to reduce that. So we'll put you on some high protein smoothies. We will want you to use like a no added sugar almond milk. We want you to then add fresh berries, blueberries, blackberries, raspberries, this purified New Zealand whey concentrate to do what? To give the body nutrients so that the body can repair, so that it does not become cachexic and begin to break down. Because remember, later on, not only are therapies abandoned, but the immune system continues to break down in advanced stages, and that creates tons and tons of problems. 31% of individuals that are undergoing chemo and radiation literally abandon, 3 in 10 walk away from their treatments. So remember today, this is not a discussion per se about whether you should or not. I have my own personal opinions about that. I think there are some cases where traditional chemo and radiation, it might be reasonably wise. I believe there are certain types of cancer, the literature is incredibly sparse, and it wouldn't be my cup of tea. Do I believe in IV vitamin C? Absolutely. Do I believe in other immune boosting protocols? Absolutely. Do I recommend high doses of time-release melatonin at bedtime with breast cancer patients undergoing therapy? Absolutely. Is that an opinion? No. Paolo Lissoni, Lissoni, you can Google this, has done some research. He's a integrative oncologist in Italy, and he's been doing high doses of melatonin for probably 12, 14 years, maybe longer, in Italy with folks that are undergoing traditional radiation and chemo. And he will tell you, his literature supports, he did it originally did it in animals, he then incorporated it into humans, that it reduces and mitigates the dangerous side effects, the damaging side effects, the low platelet counts, the low neutrophil count, neutropenia, the dropping and aberrations in your blood counts. Why is melatonin somehow miraculous, that it somehow counteracts the negative effects of chemo? No, it basically has powerful antioxidant mechanisms and protects your body. So that's just an example. Okay, let's jump forward. I'm trying to, again, without staying too general and broad brush, but not giving you too much detail. This is not an easy thing to do because there's information all over the board. I want you to understand that. Adriamycin. We know that adriamycin, it's first of all cardiotoxic, and it is used for specific types of cancer. Sometimes it's used in breast cancer, other forms of cancers, I believe, gastrointestinal cancers, colon cancers. Very powerful agent. It's actually in like an antibiotic family of chemotherapy agents. It's been around for decades. Highly toxic, just as an example, as we pull one example, to the heart. Actually to other tissues, but in particular to the heart. We know that coenzyme Q10 supplemented in patients that are on adriamycin before their therapies, during their therapies, can mitigate and reduce their cardiotoxic issues or their heart damage by using coenzyme CoQ, and actually L-carnitine is in there as well. Why? Because these are nutrients that energize the myocytes in the heart, protects your heart. Not that CoQ somehow staves off the chemotherapy. CoQ helps to protect your body so that the chemotherapy doesn't continue to damage good tissues and cells. It would be nice if we could direct the chemotherapy just to the area that is in question, right? And then not damage the peripheral tissue. Well, medicine certainly hasn't gotten there yet. So almost all of the approaches literally damage all tissues, create destruction to all tissues, the immune system, your white blood cells, your neutrophils, your lymphocytes, and so on, as well as the cancerous portion that we're battling. And again, this kill and destructive, I'm not here to argue that today. I'm here to try to bring clarity to a very controversial area and a lot of misunderstood information. Studies show, I made this note this morning, that supplementation, generically, supplementation in chemotherapy and radiation, when folks do quality forms of supplements, can enhance the quality of life in breast cancer patients. It's been done. It's documented. Now you say, well, but does it make them live longer? Yeah, there's some literature that shows that as too. This is specific right now, I don't want to be misquoted, that the quality of life when you're undergoing the therapy, you can enhance how you feel and how you function. Listen to this. 90% of the women that were enrolled in a number of trials that did antioxidant and supportive therapies during their breast cancer treatments, 90% of them had improved cognitive function. Now, why is that important? We know that breast cancer chemotherapy induces something called chemo brain. Literally, where for up to 3 to 4 to 5 plus years, women's cognitive abilities are greatly reduced. 90% of them in the study showed an improvement of cognitive functioning when they did support and supplements during. Now, remember, I'm not getting into the specifics yet. I may touch on them a little bit depending upon time later on in the second part of this. The other area, sexual functioning, physical functioning, general sense of well-being. So my physical attributes, how I feel, how I function, my ability to get through my days, do things in my home, were all enhanced, and every one of the components of this showed anywhere from 70 to 90%. Okay, generically speaking, how do antioxidants benefit? So now we're going to get into quickly, all right, we have some of the, we talked about immune system defects. We talk about why therapies are abandoned. We already know that it's controversial for multiple reasons. I will also cover that a little bit. But now, why do they benefit us? Here's some key areas. Why do antioxidants benefit? It is shown to reduce protein kinase C. Now, what is protein kinase C? Actually, there are medications and chemotherapy to try to do this. It reduces the amount of cell division. When a cancer cell is multiplying at about 8 times the rate of a normal cell. Antioxidants and specific selected protected nutrients have the ability to reduce cellular division, which is what we want to do in trying to reduce cancer spread. It reduces proliferation. Number 2, it inhibits oncogene expression. See, we can have genetic tendencies that encourage, it's called an oncogene, oncology, or a gene that wants to express more cancer-like activity or cancer aberrancies. It shows antioxidants, nutrients can inhibit oncogene expression. Number 3, it promotes differentiation of cells. Now, what does that mean? I can have colon cells, I can have liver cells, I have pancreas cells. They all are very, very distinctive. See, we just have a tendency to think that all these cells in our body are all the same. Now this is going to be a very ridiculous, but all of your cells, this is not correct. All of your cells have a distinct appearance. This is just 3 different cells. It could be pancreas, could be liver, could be heart cells. All of them have a different appearance under a microscope. The more that we can create a distinction and these cells continue to look like themselves in the future, they continue to multiply and differentiate, and they continue to have cells that look exactly like themselves. That's called differentiation. Antioxidants help to keep this separation between the cells. You say, wait, you're off path now. I thought we were talking about chemotherapy. Hold on. What we see happening in individuals that are prone to cancer, these cells all start to kind of look like one another. Cells from different parts of the body, they're harder to distinguish. You can't separate them as well. This is called cellular differentiation. What do supplements and antioxidants do? They help to create differentiation. The appearance of the cells is really what we're after, how they look, and it also decreases free radical damage. So antioxidants have 4 basic components and notes that I made. How do they benefit us? Keys to cancer. Let's go to keys to cancer, and then we're going to go to a break. Keys to cancer. What I believe are some of the keys. And you say, well, you still haven't. Well, I want to know what supplements to take. The reason why I'm not going to be able to do that, I'm going to go over generically and talk about some key supplements because it's going to vary depending upon the type of chemotherapy regimen that you're on. There are certain things that we do not recommend. There are certain nutrients that we recommend more with specific, I'll give you a generic, but there are specific things that we recommend more so depending upon the type of chemotherapy because some of the chemotherapies are more nerve toxic, they induce neuropathy. Some are more cardiotoxic, they're heart toxic. Some are more renally toxic. Some are more affecting to the immune system. So it doesn't mean that our approach and our recommendations vary 100% in every form, but there are certainly differences that we will recommend depending upon the type of drug that is being used. Some of the cancer keys. Number 1, we have a collapse in our internal defense mechanisms. And I'm always big on boosting and supporting the God-given innate immune system. We have a collapse or a breakdown in the internal immune system. Antioxidants help to reduce the amount of this collapse or drop. That's why nutrients and antioxidants can be helpful. Cachexia, I mentioned earlier, some of the literature shows up to 40% of the folks die prematurely of cachexia. All that means is just breakdown. I'm so sick from what I'm taking that I can't even eat and drink to keep my strength up. I break down from just breakdown. My body is breaking down. Cachexia. Why we recommend whey protein specific, clean whey protein smoothies with specific nutrients in them. Decrease of antioxidants. Okay, so number one is the internal defense mechanism breakdown. Cancer cachexia. I'm just breaking down from what I'm taking, not necessarily the cancer. The third area is, I think, brutally key. When I'm undergoing chemo, there's a bunch of damage. We call it oxidative damage. Oxidative damage, it's like rust in the body, if you will, that's taking place in the body. And what's bad about this, when this is happening, we have a decrease in enzymatic activity, enzyme systems, let alone antioxidant systems. So as I'm undergoing these horribly powerful drugs, it is decreasing, and actually, even though it's trying to kill bad cells, it's killing good ones, but it's reducing enzymatic activity in the body, which is critical, and antioxidant systems. Now, let me just give you an example of why this is important. Then we're going to go to a break, and we're going to come back and talk about some cautions and so on. Why is this important, these two areas? I will tell you that there's an integrative oncologist in New York. His name is Nicholas Gonzalez, that he works, I believe, with pancreatic and maybe liver, I don't want to be misquoted, or just pancreatic cancers. I know pancreatic, and it could be pancreatic and liver. And his approach is in a very aggressive approach that basically says this: I'm going to get folks on an organic diet. I'm going to get them juicing. I will do, because pancreatic cancer has a very, very minimal success rate with traditional chemotherapy. And he has shown in his studies to be able to improve pancreatic outcomes, not cure it 100% of the time, but greatly improve, I can't remember exactly the literature, 3-4-fold. I think pancreatic cancer has about a 3 to 5% success rate with chemotherapy, which is not real great, obviously. And I don't know what Gonzalez's literature show, but I would say it's 3 to 4 times that. And it could be 10, 15%. Now, that doesn't seem like much, but that's a huge improvement. And he doesn't use chemotherapy. His approaches are completely integrative, and it's live foods, whole foods, organic foods, detoxification. I believe he does some IV vitamin C, but here's one of the real key things that he does. He uses mega doses of enzymes. So now, if you're an oncologist or a medical practitioner, you're listening to this, and I know you're laughing right now. Don't laugh. You can look up information. He already has, he is in, I believe, some stage 1 trials with the FDA with his approach. I know he's worked with some folks at the National Institutes of Health. So he is respected. He's not off of the beaten path. But what he does is very high doses of proteolytic enzymes. Now, is this appropriate in all forms of cancer? I'm not saying that. I'm making a point. Some key things happen with, I call it keys to cancer. Internal defenses drop. Cancer cachexia overtakes the body. My body is so damaged from the chemo and radiation therapy, it creates so much oxidative damage. My body's overwhelmed, and the two key areas that begin to happen, my enzyme systems collapse and my antioxidant status diminishes. I almost become a prisoner to my own toxic body, basically, as to what's occurring. You see that Nicholas Gonzalez's approach is exactly the opposite of that. Antioxidant and mega enzymatic activity to raise enzymes to literally begin to degrade and break down the protective mechanisms that tumor cells protect themselves with, okay? Very controversial. I hope you're getting some insights from this. I want to give you some clarity of thought, difficult subject, without trying to get into too many of the details. We over here in the middle, we still, it's very, very important that you kind of attempt to absorb as much of this information as possible. We're going to slip away to a break. We're going to come back and wrap. There's no way I'm going to cover all this information today. We'll probably do a part 2 and part 3. Basics today: cancer and supplements in traditional medical approaches. Can they work? Can you do it wisely? Can you do it with counsel? Or do you do it willy-nilly? It's obvious it's with wisdom. This is to give you an overview. You stay with us just a couple of minutes. Let me get some water. We're coming right back. Thanks for staying with us through the break. Appreciate you being on board. Difficult subject. I know I say that all the time. This is really a difficult subject. It is. So much controversy, so much opposition to some of the things that I'm going to say here today. Let me tell you where some of this started. This goes back to a Gabriella D'Andrea, who is a oncologist, I believe worked at Sloan Kettering Memorial Institute in New York City. There was a physician that she kind of teamed up with, I believe, from Harvard. Cannot remember exactly. I believe his last name was Goldberg. They wrote a paper back in, I want to say the early 2000s, 2002, 2004. And basically that paper sent shockwaves. There were some articles that were written by both of them prior, but this one seemed to have punch. And I don't know, it was picked up in the mainstream news. And what they basically did was, and it's unfortunate, but they extracted, I don't have time to go through it, but they went through some pretty, I believe almost some pretty lame resources of information, and basically came up with this general theme that basically says this, that antioxidants, supplements that are used with chemo or radiation, okay, here was their theme, absolutely negated the benefits. This was the generic theme from their paper. And unfortunately, this spread like wildfire through the oncology community, through even general practitioners. It made its way into some very traditional journals, I believe, like New England Journal of Medicine. So it really had a ripple effect. So what happened probably, if you go back 12, 14, so it was in the early 2000s, that some of the approaches were simply this. You went into an oncologist's office, and God forbid you had been given a diagnosis of cancer. And one of the first comments, maybe not exactly this, was, look, you're my patient, and this is the regimen that we're going to look at. We're going to do this, and you might have to do some radiation. But I want to caution you and warn you. So there were red flags immediately thrown up. This happened. I can't tell you how many times this happened. Folks coming in to sit with me and said, well, the first thing they told me, before they got anything else out of their mouths, the first thing they told me, no supplements. Because there's a lot of crazy people out there that are recommending supplements with this chemotherapy and radiation, and we have literature that says that's bad and that's dangerous, it's going to hurt you. And the reality is that evidence is weak. I could literally do a whole live stream on that. But here's the real theme. The real facts are, if you look at some literature by Akita Prasad, so the key names are Gabriella D'Andrea, I believe a Goldberg, oncologist, traditional medical oncologist, saying it is evil and bad. The only thing you should do is take like a 1 a day, like a basic multivitamin. That's all you should do. The reality of it is, Kedar Prasad has written about 45 plus now, I believe, at last check, peer-reviewed articles. Peer-reviewed, meaning it was then looked at, he's a PhD, I believe in biochemistry, looked at by other writers and authors and saying, hey, his literature makes sense. He's got documentation, he has the studies. 45 peer-reviewed. Not 1 or 2, not what some of these other oncology researchers did and said, well, we're going to extrapolate a lot of theoretical information that if you take antioxidants, we give you chemotherapy. This is how bad this was. What they were saying, in essence, and I know I'm digressing, but what they were saying is that chemotherapy produces, and how it works is by producing free radical damage. Now, there are a few chemotherapy agents that do that. Most of them reduce cell replication. They don't operate via this mechanism. So what those two physicians did was extrapolate information, which was, I feel, dangerous, to say that all chemotherapy works this way. The reality of it is it does not. Very few of them. Some of the older agents do. A lot of the newer agents, the last 15 to 20 years, do not. This was old information. And so they said that if you do chemo, this is what we're trying to do. And if you take supplements, you reduce this. Therefore, you are reducing the effectiveness of what we're trying to do. Don't do it. Reality of it is that that's not the way most of them work. Now, radiation works by creating free radical damage. So we make specific recommendations, what you should do up until radiation, not the day of radiation. You go through your radiation, the next day you go back, or a day or two later you go back on your regimen. It's a pretty simple approach, okay? So this was the theme, but now let's jump forward. Keter Prasad, 45 peer-reviewed articles, and I had to make notes because there's so much information. Prasad basically showed there were 4 basic tenets of what happened. Number one, there was an improvement in the research that he did. Oncology outcomes generically improved. I can't get into the specifics, but generically speaking, when folks took quality supplements under supervision, outcomes improved. People did better. I'm not saying maybe they were cured from their antioxidants, but they had better quality of life. They had an increase in lifespan. They lived longer. All right. Number 2, there was a decrease in the amount of toxicities, which is critical. How many folks have you known or seen that are family members and you've watched them brutally suffer and you're basically told, well, this is what you have to do. I can't help it. We brutally suffer through the chemotherapy regimens. The toxicities many times do us in. In his 45 peer-reviewed articles, he shows 2 basic points. There are 2 more. That there are improved outcomes in quality of life and improved lifespan, diminished toxicities. Third, just as important, this is key, that low doses, which other oncology, what did that Gabriella DeAndrea and Goldberg say? You should only use little bits of these things because a little bit doesn't interfere with what we're doing. You know what the reality of it shows? He showed that when folks do these little bits and they have low amounts, you actually have decreased outcomes, quality of outcomes. All right. Number 4, high doses, targeted, now I have to qualify that, targeted, with wisdom, done with counsel, because you shouldn't do certain things with certain types of chemotherapy. So I'm qualifying, please don't misquote me here. I can't afford to be misquoted. High doses, correctly done, improved outcomes. And I can't spell, once again. Improved outcomes. So here's basically what he showed. Honestly, this guy knows what he's talking about. Not only does he know what he's talking about, he didn't just take a little bit of information and then go write a paper that then created shockwaves. He said, look, I'm not buying it. I'm going to go back and I'm going to do my own research. I'm going to pull animal studies. I'm going to pull human studies. I'm going to look at the quality of the studies. And I'm going to let other professionals review my information. And when it passes the peer review, we're going to let it stand for itself. Improved outcomes when people did supplementation. Reduced toxicities when people did supplementation. Low dose things actually showed worse outcomes. Outcomes is outcome of your therapy. High dose therapies showed improvement in outcomes. Now, I can't go through and document 40, you'll fall asleep if I try to give you these 30, 40, 50 articles. There's more than that. It's over 45. At the time of the writing, the information I pulled, 45 different articles, okay? Key components. The other one would be Kenneth Conklin that I would call. Kenneth Conklin is out at UCLA. It does some integrative types of work, I believe, but he qualifies everything and says that you have to do it under the supervision of a healthcare professional. You should work with someone that knows what they're talking about. You shouldn't just do this on your own, because there are certain things that you should not do, and I believe that I agree with him, and then you should do it with counsel. So a couple other quick things. Let's just talk very quickly about IV vitamin C. IV vitamin C. IV vitamin C, a Mark Levine at the, I believe, the National Institutes of Health, actually working for the government, looking and doing a research piece, basically showed this, that mega doses, high doses of ascorbates of vitamin C actually did a couple of things. Number one, it raised what's called hydrogen peroxide, which you're all familiar with, within the cell, inside your cell structures, which led to what we call cytotoxicity. It killed cancer cells and preserved healthy cells. Now, that information will sit at the NIH forever, because no one's going to try, you can't patent IV vitamin C, so you can't get a drug patent right. It's expensive to do on an ongoing basis, certainly, but you have integrative physicians around the country doing this, and with some amazing results. Let me give you another name. I believe her name is Jean Driscoll. She's an oncologist. She works with the cancer center in, I'm drawing a blank, out in Kansas, and she works with, I believe, the University of Kansas. And they do integrative approaches where they do chemotherapy plus IV vitamin C. She does integrative types of concepts with some amazing Reardon. She works for the Reardon began to do IV vitamin C, I believe, back to earliest 1970. Very much ahead of his time. I believe he passed away at old age just a few years ago. His clinic still runs and functions. It's amazing. I believe it, I can't remember where, but it's in Kansas. And this Jean Driscoll, who works at his clinic, also is hooked up with the University of Kansas, looking at some of these integrative approaches. So I bring these two names up because these are folks that have worked in this area, shown some benefits, and to me, in my mind, as a counter to what we see with the world of it's negative, it's bad, it's harmful. I feel like we're kind of out of time. I believe that we've kind of maxed our time. We are going to, no doubt, have to roll over to a part 2. As I began to work on this yesterday, I knew in my heart there'd be no way I could cover it in one. But this is a good start. So instead of trying to just rush through in the next 3 minutes, I'm just going to cut it here. And our next one, so this will be cancer treatments and supplementation. Can they live in harmony, basically? Can you do them? This is the overview. So maybe we'll title it an overview, cancer and supplements, an overview. And then we'll go into a part 2, possibly even a part 3. We'll start picking apart and talking a little more specifically about nutrients, about what they do, about what are some protective things, and then I'll give you some specifics to go along with that. God bless you. Thanks for tuning in and being with us here today. Very touchy subject. I would hope that what you would consider doing is if someone, a friend or a family member that is battling some issues with cancer, and I don't want you to twist their arm and tell them, you need to go do this, because sometimes then we put ourselves out on the limb. I believe if nothing else, let them be educated by the information and then let them make a quality life decision on their own. If we aren't at least exposed to information that can help us, I believe that is a mistake. At least be exposed. You digest it, you assimilate it, you pray about it, and if you believe that this is not for you, no harm, no foul, no offense, but at least take in what's out there. Psalm 5, I started the show with this. Many, Lord, are asking, who will bring us to prosperity? let the light of your face shine upon us. Now, this prosperity is not just financial, but favor and the presence of God and the chokmah, the wisdom, the protective, the refuge, the support of God. Let the light of your face shine on us. Fill my heart with joy, said David, when their grain and their new wine abound. So when good things are going, let my heart rejoice when good things are happening. In peace I will lie down and sleep, for you alone make me to dwell in safety. Psalm 5, David goes through the laments. He's having a bad time. It's a downtime in his life. It's horrible. But I'm just going to go right to verse 11 and we're going to close. But let all who take refuge, all, in your difficulties, in my difficulties, instead of running from God, in my sin, in my error, instead of running away from Him, the Bible teaches us, and David is the perfect depiction to run to. David had an affair. David had a child out of wedlock. David had the husband of that woman killed, Uriah, to cover his sin. He wrote no Psalms for 18 months. The historical value shows nothing. He was away from God. He became arrogant. He became distant. He became self-consumed. When David finally broke down, listen to my words, O Lord. Consider my lament and hear my cry for help. You are my King and my God, and to you I pray. He repented. He turned. And he says, all of you that will take refuge will be glad, and let them ever sing for joy. God bless you. Thanks for being with me. Part 2 is coming. I hope you learned something from this today. God bless you. I'll see you next time.